Now, at the top of the hour, we are going to have a guest interview. But before we get there, we're going to do a little bit of a throwback here for our clinical conversations on today's show. And we're going to have a short, abbreviated version of the full presentation that Dr. John Rosa gave at the Smart Chiropractor's Axis clinical event earlier this year. This was one of the standout presentations that we saw that day. We are looking forward to having Dr. Rosa on this show in 2022. But to get you excited for that, he packs so much information. This is going to be a short preview of Dr. John Rosa's presentation on the opioid epidemic that he gave on an Axis 2021.
Hi, all. I want to welcome everybody to the Access C2 clinical conversations. Thanks, Smart Chiropractor, and the good people that are putting some work out there for us to get these tidbits of information. One, to learn, and two, to utilize in practice. So I hope this information will help you in both. So I'm going to, what I would like to do is actually fire hose you with some information as to what we're going to be talking about, which is the opioid crisis, mental health, why they overlap and why they're so concerning, and in a post-COVID period that we're going to be heading into. When I say post-COVID, I'm talking about the next 5 to 10 years and what some of those devastations that we're looking at that could take place without some intervention. So there's going to be a lot of information to understand, which I think is the first most important thing for people to know a material and be able to use it while you're out marketing or discussing this with the medical community or sources of referral. You really do have to understand some of the logistics, the data, the information, the research, our own research as to why we can help. So I'm hoping that I'm going to be able to give that all to you. I know the timing on this. I lecture this anywhere from 1 hour to 12 hours, literally. So I'm hoping to pack a lot into a short period of time. So if I do talk a little fast and there's some things skipping and you feel like you're missing some of it, do not hesitate to reach out to me. I'll have some of that information at the end of the presentation. You feel free to do so. And I have a vision and mission along this path that I've taken. So I will not stop until everybody has a little bit of information to help as much as they can. So again, I'm Dr. John Rosa. I have 17 integrated medicine clinics around the Washington, D.C. Area in Maryland and Virginia. I'm a national expert in the opioid crisis, and I consult for a ton of task force, some corporate stuff, hospital systems, a surrogate to the White House for a few administrations. I've written some stuff in the book, and I've done my own neuro research. Neuroscience has kind of been, since my days back in undergrad and Rutgers University, has been a little bit of a sweet spot for me. So I'm really pushing some of the research side as well. So I'm going to hide my screen here so we don't have to look at my face after this introduction, but I want to go through my presentation so that you can see the full part of it. So let's look at why, I mean, for me, imagine a world without opioid overdoses. That was originally my quest, and addiction is now kind of wrapped into my head as not just opioids, even though that is what stimulates our profession as chiropractors to be able to have the conversation as why we should treat through pain as opposed to prescribing through pain. It is pretty massive right now. We've never been in a better position to go knock on doors to get in line to get those patients. Finally, that system is so broken, they're looking for alternatives and looking for things that they can send. And the younger generation of doctors understand it quite well. So we're in a really good sweet spot. But for me, it started out just because I saw the writing on the wall, like most of you, I'm sure, when you're in practice for as many years as I am, that there was some differences that were taking place in how our patients were coming into the office, where we were seeing a series of people with prescriptions that were not just your anti-inflammatory, but people coming in and on them for periods of time and changing their entire disposition, and then the needs and complaints of needing more medication. So I know the numbers were there. This is about 8 years that I've been working in this field with the opioid crisis. And for obvious reasons, the last 4, it's gotten more news with the corporate stuff and Purdue and Oxy and all the things that are shining in there that we have the crisis. But that's how I got into this, because I just thought we were leading down a path of no return, and you'll see from some of the numbers that that's an absolute truth. So what is a crisis, right? So the crisis, the opioid crisis, the mental health crisis, there's that overlap. And to understand it just a little bit better, we want to look at a snapshot of a single day in the United States of America. Literally, I'm going to read through these, but I want you to understand that this is an average day in our country. 500,000 prescriptions for opioids are still written on a daily basis. That's down from about 600 and change. So there has been a dent in there, but as you can tell, that's still an extremely large number on a daily basis for those to be written. 4,000 people start non-medical use, which is that diversion of somebody having a prescription sitting in a medicine cabinet and the grandchild pops in there and grabs them out of a grandparent's medicine cabinet, which this is what we call diversion, but there's 4,000 people starting non-medical use. 600 people daily start heroin use as that leap from prescription pills to heroin, which I'll explain later in the presentation. 3,300 visits to the ER, 90 babies born addicted, 160 people die of opioid overdoses every single day, and 90 of them are now related to fentanyl, which I'll explain what that crossover looks like as well. Those stats are staggering, but they're also underreported. Drug driving deaths, drug-related gun deaths, overdose versus suicide, it depends on what the coroner does and how they report things, but there is definitely an underreporting. So these numbers, it's not a drastic difference, but you have to add a percentage over what I just said to you as a daily basis, because it's not there. 1 in 10 people seek help. So it's hard for us when there's an addiction, a dependency to these things. Only 1 out of 10 users or people who suffer with addiction actually reach out to get the help. So sometimes our tracking ability is diminished as a result of that. Then there's the massive distribution of Narcan. That's a big deal too, because our numbers only went down slightly in 2018. They've been going up steadily since 2012, 13, where the drastic jumps were. 18 had a little bit of a blip because there was a lot of attention put on it. But before COVID, we had a massive increase for whatever reason, we don't know, but there was a huge increase in usage and in overdose deaths. Those numbers are now staggering as we see a pandemic punching epidemics in the teeth. But we had an increase in 486% distribution of Narcan. So while all these deaths are increasing and overdose numbers are increasing and hospital ER visits are increasing, Narcan is gone up by close to 500% and distributed all over. So it's being utilized to bring people back. And that was only in the last couple of years. What if that didn't happen? How staggering would the numbers be of the increase in the number of deaths? There's some estimates that say it would be over double. So if we're losing 160 people a day, you can imagine what that would look like. It's really a jet crashing on every single day, losing everybody that's in it. And yet we still don't have that enough of an upset mark coming through.
All right. That presentation is incredibly powerful. There, he was just getting into the edge of the stats right there. That was given during Access, our Smart Chiropractor clinical event that happened online earlier this year. You're going to want to be on the lookout next year for Access 2022, where we bring together what we believe are some of the smartest clinical minds inside and outside chiropractic to teach about topics that are relevant to practice today. So we touch on all aspects of practice. The speaker list in 2021 was unbelievable. It was incredible, and we're looking forward to an awesome 2022. Again, that was from Access. We'll highlight with some of our clinical conversations, we'll highlight some additional talks that we thought were very, very powerful. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.